Over the last few generations, we have seen some remarkable changes in families across Pakistan. And I would like to start by sharing with you the story of a young woman, Munawwara, and her family.
मेरा नाम मुनव्वरा है। मेरे 2 लड़के हैं। मेरी और मेरे शौहर की ख्वाहिश है कि हमारी एक बेटी भी होनी चाहिए, लेकिन हमारा ये फैसला है कि हम तीसरे बच्चे के बाद मजीद बच्चे पैदा नहीं करेंगे। लड़का हो या लड़की, हम खुश होंगे, क्योंकि मेरे दोनों बच्चे ऊपर तले हुए, इसलिए दूसरे बच्चे के बाद बहुत तबीयत खराब हो गई थी। मेरी हालत देखते हुए ही मेरी अम्मी ने खानदानी मनसूबाबंदी इस्तेमाल करने का मशवरा दिया। मेरे शौहर और ससुराल वालों ने भी मेरा बहुत साथ दिया। हम बहुत खुश हैं कि हम अपनी मर्जी के मुताबिक अपने बच्चों में वफ़ा कर सकते हैं, और वफ़े की वजह से अब मेरी सेहत पहले से अच्छी है और मैं बेहतर तरीके से अपने खानदान का ख्याल रख सकती हूँ। मेरी माँ के भी 5 बच्चे हैं, मेरी नानी के भी 8 बच्चे हैं। मैंने देखा कि इतने सारे बच्चों को पालना बहुत मुश्किल काम है। मेरी माँ ने ही मुझे खानदानी मनसूबाबंदी करने और कम बच्चे पैदा करने का सही मशवरा दिया। कम बच्चों की वजह से हमारी माली हालात भी बेहतर हुए हैं, और इसी वजह से हम अपने बच्चों को अच्छे स्कूल भी भेज सकते हैं और उनकी जरूरियात भी काफी हद तक हम पूरी कर सकते हैं।
This is a true story, and we can see how Munawwara's life has changed. She is better off than her mother and grandmother. So what has made the difference from one generation to the next? Munawwara has more years of schooling than her mother, and the changing status of women has also played a role. But one factor in particular, family planning, has helped bring about these improvements in the health and well-being of Munawwara and her family. There are millions of stories like Munawwara's across the generations in Pakistan, and we can see this generational change and the progress that Pakistan has made over the years when we look at what has been happening to family sizes across the country. Here we have a graph where we can look at changes and trends over time, and we are going to focus specifically on the number of children per woman and family planning use. Here on the left axis, we are looking at the total fertility rate, or the number of births a woman will have in her lifetime, ranging from 1 to about 7 children. And on the bottom axis, we are looking at the percentage of married women using family planning ranging from 0 to 40%. This bubble here is Pakistan, and the year is 1975. In 1975, in Pakistan, women were having between 6 and 7 children, and about 5% of women were using family planning. Now let's see what happens to family planning use and fertility over time. You will see the years flashing by in the background. Despite an initial decrease in family planning use, you can see that as the bubble moves to the right, family planning use is increasing, and as the bubble is moving down, women are having fewer children. And when we get to 2007, you can see we have made progress. The percentage of married women using family planning increased from 3% to 30%, and at the same time, women went from having an average of about 6 children each to about 4 children each. So we have made progress in improving family planning use and having fewer children. Most other countries of the world have followed a similar pattern with increasing family planning use and decreasing family sizes. Let's take a look. Again, we have a similar setup with number of children per woman on the left ranging from 1 to about 8. And on the bottom, we are looking at the percentage of married women using family planning ranging from 10 to 80%. In the graph, we have many countries of the world for which data were available in the early 1970s. Each bubble is a country, and the size of the bubble corresponds to the population size of the country, and the color corresponds to the world region. So this is what the world looked like in 1975. Starting with the red are countries in East Asia and the Pacific. The orange is Europe and Central Asia. The yellow is North and South America. The green is Middle East and North Africa. The light blue is South Asia. And the dark blue is Sub-Saharan Africa. More countries will come in as data become available, especially for Sub-Saharan African countries. Where is Pakistan? Here we are with about 5% of women using family planning and 6 children per woman. Now let's see what happens to the world over time. You can see that all the bubbles are moving to the right, which means more women are using family planning. And as the bubbles are moving down, that means women are having fewer children. When we get to the year 2005, we can see that the world has changed. Most countries have moved further towards the bottom right-hand corner, with more women using family planning and fewer children per woman. The countries in the top left-hand corner are Sub-Saharan African countries with lower family planning use and more children per woman. And in the bottom right-hand corner are mostly countries in East Asia and Latin America with higher family planning use and fewer children per woman. And where is Pakistan? Here we are, at 4 children per woman, just bridging the gap between Sub-Saharan Africa and most other countries. An important point is that Pakistan's total fertility of 4 children per woman includes all women ages 15 to 49, regardless of whether they are married or not. However, when we consider only married women, and knowing that most childbearing in Pakistan takes place within marriage, married women are still having 6 children. So although we have made improvements over time, we still have a long way to go. Now, Pakistan was actually among the first countries with a population policy and program, and this is extremely commendable. In fact, Pakistan's program was viewed by many as a model program. It's because of these early policies and programs that family planning use in Pakistan has been on the rise for many decades. However, in recent years, it has begun to stall and is hovering at around 30%. And this 30% includes modern and traditional methods. If we take a closer look at what is really happening and divide family planning use into traditional and modern methods, we see that only 22% of married women are using modern methods of family planning, which are generally more effective. Most of the modern methods used, however, are permanent methods, which means that couples are not necessarily using family planning for spacing, which would improve the health of mothers and their children. If we look at the difference in family planning use between urban and rural areas, we can see that while 30% of women in urban areas are using modern family planning, only 18% of women in rural areas are doing so, which is about half the number. Given that 2/3 of Pakistanis live in rural areas, it is important that we pay special attention to the rural population. In addition to these women who are using family planning, there are many more women who would like to plan their families but are not using family planning. In fact, about 25%, or 1 out of every 4 Pakistani women, would either like to stop having children or would like to wait 2 or more years before having another child, but are not using any method of family planning. These women are considered to have an unmet need for family planning. High unmet need for family planning can lead to higher rates of unplanned pregnancies, and in Pakistan, 1 out of every 3 pregnancies is unplanned. One of the consequences of unplanned pregnancies is high-risk pregnancies and births. That is women having children too young, before the age of 18, women having children too old, after the age of 35, women having too many children, all of those unplanned births, or women having children too close, spaced less than 3 years apart. In addition to these high-risk births, another consequence of unplanned pregnancy is abortion. Every year in Pakistan, about 900,000 pregnancies end in abortion. These numbers are high, indicating that abortion is a significant means of preventing unplanned births in Pakistan. So why are so many women seeking abortions? According to the 2004 National Abortion Study by the Population Council, the two most common reasons are that couples already have the number of children they want, and that it would be very difficult to afford another child. In fact, most women who have abortions in Pakistan are age 30 or above, and they already have 3 or more children. Here is a quote from a 35-year-old woman from Faisalabad with 5 children who opted for an abortion after discussing it with her husband. My husband says, in our given income, it is difficult to bring up even these 5 children. We cannot have any more. For this reason, I opted for Safai. Why are so many couples turning to abortion instead of using family planning to prevent these unplanned pregnancies? Many couples who opted for an abortion said they did not believe contraceptives were effective. Many felt that contraceptives had detrimental side effects. In some cases, women reported that their husbands disapproved of using family planning. Another important reason was cost. Although the cost of an induced abortion was high, it was a one-time expense, and apparently one that couples felt more comfortable managing. All of these issues are further compounded by inadequate services. For example, healthcare providers do not always provide information and counseling to clients about the various family planning methods, especially modern methods and their side effects. In fact, 2/3 of women using modern family planning were not informed about the side effects, and 62% were not informed about other available methods. Additionally, women who visit a health facility to deliver a baby or for medical treatment following an unsafely performed abortion do not routinely receive family planning services, which is a real missed opportunity. If more couples used family planning and used it effectively and consistently, we could prevent unplanned pregnancies, reduce the number of abortions, and we could save the lives of both mothers and children. So how can we increase family planning use, which currently stands at 30%, including both modern and traditional methods? As an initial step, we can fulfill the unmet need for family planning. And if we are able to satisfy unmet need, family planning use would increase to 55%. And in fact, one of the objectives of the new draft of the Population Policy of Pakistan is increasing family planning use to 70% by the year 2025. So let's turn back to our graph to see the impact that family planning can have. Coming back to our graph, we are now looking at the number of pregnancies in Pakistan, and this time we are going to project into the future. On the left, we have number of pregnancies ranging from 5 million to almost 7 million. And on the bottom, we are looking at time. And in the year 2007, there were just over 5 million pregnancies. Now looking into the future, we can project that if things stay the same and women continue to have high unmet need for family planning, the number of pregnancies will increase dramatically. And when we get to the year 2015, we will have well over 6.5 million pregnancies. However, if we were able to meet the unmet need for family planning, what would happen? Now this light blue bubble shows what would happen to the number of pregnancies if unmet need were fulfilled. And you can see that we would have far fewer pregnancies. In the year 2015, we would have about 5.5 million pregnancies instead of over 6.5 million. That's 1 million fewer pregnancies, most of which would have been unplanned. Increased family planning use also has the potential to decrease the number of abortions by preventing unplanned pregnancies. In fact, we can see the relationship between family planning use and abortion in several countries. As the percentage of women using modern contraception increases, the general abortion rate goes down. That means fewer abortions even take place. And here is Pakistan in blue, with relatively low family planning use and a relatively high rate of abortion. Now, if we could increase our family planning use, we could decrease our abortion rate, and in addition, we could also save the lives of mothers and children. If we could fulfill the unmet need for family planning in Pakistan, we could prevent around 23,000 maternal deaths and close to 1.1 million child deaths by the year 2015. How could we save so many lives? Because when couples can time and space their births, this results in fewer high-risk births, which means mothers and children are healthier and have improved survival. So let's take a look at where Pakistan is in terms of family planning use in relation to some other countries in Asia. Coming back to our graph, on the left axis, we are looking at the total fertility rate or lifetime births per woman ranging from 1 to about 7 children. On the bottom axis, we are looking at the percentage of married women using modern family planning methods ranging from 0 to 50%. And these two bubbles here are Pakistan in blue and Bangladesh in green. In 1976, in Pakistan and Bangladesh, only about 4% of women were using modern family planning, and they were having about 6 children each. Now let's see what happens over time. In 1976, the government of Bangladesh declared rapid population growth as the country's #1 problem. Here, in 1983, the community distribution program was expanded to more rural areas. And then, in the late 1990s, there was a focus on integrated services for both population and health. And you can see Bangladesh in green moving ahead of Pakistan with increased family planning use and a decrease in number of children per woman. And when we get to the year 2007, Bangladesh is down to 3 children per woman, and almost 50% of married women are using modern family planning. Meanwhile, although Pakistan has made progress, we are still at about 4 children per woman, and only 22% of married women are using modern family planning. Bangladesh is not the only country that has made so much progress. Let's take a look at some other countries in Asia. Here we have a similar setup with number of children per woman on the left and modern family planning use on the bottom. And these bubbles here are Pakistan in blue and Indonesia in red. In 1975, in Pakistan, about 3% of women were using modern contraception, and women were having about 6 children each. And in Indonesia, about 14% of women were using modern family planning, and women were having about 5 children each. Now let's see what happens to family planning use and fertility over time, and you will see Iran entering in a few seconds. Already in the early 1970s, the Indonesian Family Planning Board begins its village-based family planning program using local field workers. And you can see the increase in family planning use and the decline in number of children per woman. Meanwhile, Pakistan is making some progress. And then in 1989, Iran enters in green when the government officially launched their family planning program, making family planning services free to all married couples with a dramatic decrease in the number of children per woman. Meanwhile, Pakistan is catching up slowly, and when we get to 2007, you can see that in Indonesia and Iran, over 50% of women are using modern family planning, and women are having between 2 and 3 children each. And here is Pakistan, with 22% of women using modern family planning and 4 children each. So although Pakistan has made progress, we have not made as much as we could have. Why have Indonesia, Iran, and Bangladesh, which are all Muslim countries, been able to progress further? Because the governments in these countries made a political commitment and financial investment towards family planning. And like them, we too can continue to make progress, but only if we make a similar commitment to improving family planning use in this country. We have done it in the past, and we can do it again. In addition to saving women's lives through improved use of family planning, women's lives can also be saved through abortion-related services. The current abortion law in Pakistan, which was amended in 1990, states that pregnancy can be terminated if carried out in good faith during the early stages of pregnancy in order to save the life of a woman or to provide necessary treatment. Many providers are unaware that abortions are permitted to provide necessary treatment. Most of the 900,000 abortions in Pakistan are performed under unsafe conditions, meaning they are carried out in an unclean environment or by unskilled providers or both. Consequently, many women suffer from post-abortion complications that require medical care. In Pakistan, almost 200,000 women are treated in hospitals every year due to complications from unsafely performed abortions. And there are certainly many more cases that do not reach hospitals. That means a woman is treated for post-abortion complications every 3 minutes from a cause that is almost entirely preventable. Not only do unsafely performed abortions have an impact on women's health, they also place a burden on the healthcare system, which is not adequately equipped to handle the large number of cases. Consequently, the quality of care provided for post-abortion complications is poor due to inadequate training, limited female staff, and lack of equipment. Additionally, most service providers who perform abortion-related services do not use newer and safer methods recommended by the World Health Organization, such as manual vacuum aspiration and medication abortion, which are simpler and less invasive. Clearly, there are gaps in implementation, but we can do better. First, we need to improve the use of family planning to meet the needs of couples who would like to plan their families. And if we are able to increase family planning use, we could drastically reduce the number of unsafely performed abortions taking place every year. In addition, women should have access to abortion-related services when the need arises in accordance with the law, so women do not suffer from death and disability. After all, the loss of a mother means the surviving children are left behind, and this has an impact on other family members as well. So what can we do to strengthen family planning and abortion-related services? We need to expand access to family planning services, especially in rural areas, by using our outreach workers more effectively. And we need to ensure that women who visit a health facility to deliver a baby or for post-abortion care receive family planning services. We need to ensure that more facilities are equipped to provide newer and safer methods for abortion-related services. And we have to engage men as clients, partners, fathers, and agents of change for family planning and abortion-related services. One way to do this is by ensuring that couples receive adequate counseling from providers, especially around modern family planning methods. Now, the government is working on new health and population policies, laying out many of the issues we have covered. However, we must ensure that the policies are implemented effectively. So what does the future hold for Pakistan? Looking back at Munawwara's family, what will the future be like for her children? For the millions of other Pakistani children, will our daughters grow up in an environment where they can plan their own families? Will our sons grow up understanding the importance of planning a family that they are able to take care of? What does the future hold for the many generations to come? With your commitment and investment in proven and effective interventions, we can improve the health of Pakistan's families and leave a better nation for our children, keeping future generations on the rise.